Hey everybody, welcome to our School Medicaid Lunch and Hour series for 2019-2020 school year. Today's topic is, what is free care and what does it mean to me? Today also happens to be National Pasta Day. And you know, it occurred to me that every time I give you all a national holiday, I'm always using food. National Ice Cream Day, National Banana Split Day. And I guess it makes sense. This is a lunch and hour, so hopefully you're all celebrating responsibly. Pasta Day today while you're listening to the Lunch and Hour. Hey, I'm Bob Bundy, your presenter. I've got my contact information on the screen. If you have questions or comments about today's topic or anything to do with school Medicaid, give me a call after the session today or drop me an email. Always happy to visit with folks about school Medicaid. Now, in the last couple of weeks, I met a lot of really great people at the National NAME Conference. And thank you all for those of you who are listening, who introduced yourself to me or who came to my session at NAME. I really appreciate it. Always enjoy meeting new folks. Now, for any of you out there today who are first-time attendees for the Lunch and Hour, first, thanks very much for attending. And second, if you're interested in receiving just an automatic notice whenever we schedule upcoming Lunch and Hours, you can go out to the website, go to the events menu, and you'll see a list of all the upcoming Lunch and Hours or any other events that we have going on. And over on the right-hand side of that same screen, you can sign up just to get automatic emails on upcoming topics. We don't use your information for anything else other than just getting word out about the Lunch and Hours. So today we're talking about free care. Well, I'm talking, you're listening. Or talking, whatever. I have two learning objectives for today. First, I'm going to define free care. What does that mean? I'm not going to give you just two quick sentences. I really want folks to understand this because there's a little bit of background there and it's a pretty heavy subject. And so when folks start talking about implementing it in their state or it's coming to your state, really want you to have that overall knowledge. And second, I'm going to look at what the free care impact would be on three different perspectives if it comes to your state. First, the state Medicaid agency. Second, the LEA or school districts. And third, billing companies. We have all those people who are represented on a regular basis here at the Lunch and Hours. So I want to make sure that everybody understands how this could impact them. So let me start off. What is free care? First, we have to get in the Wayback Machine. And frankly, if you don't know Mr. Peabody and the Wayback Machine, you really need to study up in your 1960s cartoons. So after the Lunch and Hour, I'm just suggesting that most of you surf the web all afternoon looking for things about Mr. Peabody, maybe study up on Johnny Quest, Boris and Natasha, Rocky and Bullwinkle, and of course, Scooby-Doo, although I don't even really understand why Scooby-Doo is still so popular. So let's go back in time. I have two timelines here. I have a special education legislation timeline and a Medicaid legislation timeline. I'm going to start in 1965. 1965, Medicaid is authorized, not school Medicaid, just Medicaid. Obviously, you can't have school Medicaid unless you have real Medicaid first. 1975, 10 years later, we get PL 94-142, which today we would call IDEA. It's the first authorization at the federal level of special education resources, requirements, funding, those sort of things. It included FAPE, IEPs, evaluations. A lot of the same things we know of in IDEA today were first authorized in PL 94-142. And also, this is really important, this law was called the Education for All Handicapped Children Act. And that's important for our next topic that pops up here on the timeline, and that is school Medicaid. School Medicaid's authorized in 88, which is 23 years after regular Medicaid, and it's a huge act. It's a huge act really around Medicare, and there's just one little paragraph kind of buried in the middle of this thing about school Medicaid, and it does not say schools can bill for Medicaid reimbursement. What it says, and I'm just going to show it to you here, but I won't read the whole thing to you. It says there's nothing in the law preventing schools from billing Medicaid for reimbursement if the services are provided as part of the Education for All Handicapped Children Act. And again, we know that the Education for All Handicapped Children Act is the special education authorization. So this basically says, hey, school districts, there's nothing preventing you from billing for Medicaid reimbursement for services you're providing to kids covered under the special education law. All right. Now, at the time when this came out, no state plans covered school Medicaid. Of course, it hadn't really been a thing before that. So they all started writing their state plan amendments to add it to their state plans. And they looked at this language right here on the screen, and they wrote their state plan amendments around it. So the majority of school Medicaid state plan amendments written at this time have things in it about special education or IEPs or IDEA as it's evolved over time, or the term Education for All Handicapped Children Act. So almost all the state plans that I've ever read written around this time or subsequently to this were written around reimbursement for services provided to kids receiving special education services. Okay, so back to our timeline here real quick. 1997, the special education legislation was updated, reauthorized under IDEA. And in that same year, CMS comes out with a free care policy guidance. And here's what it was about. So again, 1997, 32 years, no, 32, no, let's see. A long time ago. Here's where we go. First, about 13 to 15% of kids in the U.S. public schools receive special education services. Kind of varies a little bit year by year, but right in that 13 to 15%. And we know that school districts can bill Medicaid for reimbursement for those services. That's what that 1988 clause in that act said. Hey, if these kids are receiving special education services and those kids are Medicaid eligible, you can bill for reimbursement. So let's set those kids aside for right now, because this free care guidance from 1997 affects all the other kids, the other 85% of kids in our schools. Now, some of these kids may be receiving medical services too. Some of those may be under a 504 plan or an individual health plan or other kind of plans, okay? Some of those kids may be receiving services that are covered by no plans at all. So again, I'm defining free care. Here's a real life example. We have 2 kids in our school. Of course, we've already set the special education kids aside. So these are kids who are not receiving special ed services. 2 kids, okay? One of those kids is enrolled in Medicaid. One of those kids is not. Maybe he's covered, his health care coverage is covered by his parents', insurance or something like that. Both of these kids go to the school nurse every day to receive the same service. Maybe it's a Medicaid or medication administration, insulin injections or controlled substance or something like that. Each day they go to the school nurse, and that school nurse provides a service that is reimbursable under Medicaid. What free care said in 1997, or what CMS said about free care in 97, is you cannot bill Medicaid to reimburse the services for this kid who's Medicaid eligible if you're providing that same service to other kids for free. And we are providing this service for free. We're not charging that kid's parent, or we're not billing their insurance company. That kid just comes into the school nurse's office every day and he gets his medication, no charge or administration, okay? So free care says, oh boy, we know these kids are Medicaid eligible. We know they're receiving a covered service, but if you're providing that same service to other kids for free, you cannot bill Medicaid for reimbursement. All right, back to our timeline. That was in 97. In 2014, right at the end of the year, so just about 5 years ago now, CMS wrote a letter out to all the states and it said, hey, remember in 97 when we gave you that free care guidance and we told you you cannot bill Medicaid for reimbursement for these kids if you're providing that same service to other kids for free? Well, we take it back. You can now bill Medicaid for reimbursement for those services if your state plan allows it. So states can bill Medicaid for reimbursement for those services, but the state plan has to support it. The majority of state plans did not support it in 2014 when they changed this. Why not? Because remember, when they wrote their state plans, they were writing it around that language that was pointing to the Education for All Handicapped Children Act, or what we know today as IDEA. So everybody's state plan had a lot of restrictions in it saying, hey, our state plan is going to reimburse these services, but these services are all around IEPs and special education. Here, CMS comes out in 2014 and says, you don't have to just bill for Medicaid or for special education services. You can bill for other stuff now too. But everybody's state plan didn't support it. Okay, so the guidance came out in 2014. Not a lot of people could take advantage of it. Their state plans didn't allow it. So where are we today? States who want to bill for these services, one, you have to make sure that your state plan allows it. Again, most don't. So you need to change your state plan by filing what's called a state plan amendment. And basically, your state Medicaid agency writes a letter to CMS and they say, CMS, we want to change our state plan to include reimbursement for these kids in addition to the kids that we've been reimbursing these services for in the first place. Now today, only after 5 years of this, only a handful of states have done it. The one that I know of that's the most recent is Michigan. Their state plan amendment was authorized and approved by CMS in August, so just a couple of months ago. There are other states that have done this, California, Massachusetts, New Hampshire, Connecticut, those sort of things. But why haven't more done it? Well, there are a couple of reasons. Politics is the first one. You know, when the Supreme Court struck down the mandate of the Affordable Care Act that required states to expand Medicaid. Don't know if you guys remember that from a few years ago. Several states said, no, we are not going to expand Medicaid. So a free care spa might just not be politically popular in some states. You know, again, if you submit that spa and CMS approves it, all of a sudden your Medicaid, your school Medicaid program is reimbursing for more kids, for more services. And politically in your state, if the expansion of Medicaid was a big deal, that might not fly. Second thing is the state plan amendment process itself. If you need to change your state plan to take advantage of this, you have to give CMS, you know, what you want, and that's called opening your state plan. And here's the deal. When CMS looks at the state plan amendment you're giving them, they will review it, they may approve it, they may ask you questions, but they have the option, CMS does, of making you change anything else in your state plan that they want you to. So you might turn in a state plan amendment that says, hey, CMS, we want to change this one little thing. And CMS can say, okay, state, that's good. We'll approve that one little thing. Oh, but to do that, we need you to change these other 5 big things. And a lot of states are a little gun shy on that. You know, their state school Medicaid program is working fine, and they don't really want to go through the SPA process. And I think that's probably what's held most states back. And then the last one is there was a concern when this change came out in 2014 that some states could expand their Medicaid reimbursement to cover these services, and yet individual school districts could see their total Medicaid reimbursements actually decrease. So you would think if you're filing for reimbursement for more services for more kids, your revenue would increase. And if you're in a fee-for-service reimbursement state, that's exactly the case. No doubt about it. But if you're in a cost reimbursement state, there are a lot of different formulas and ratios that go into the calculation of your total reimbursement. And a lot of folks, when they looked at that, they thought, oh, you know, we're going to have to change some of the ratios we use. And even though we're documenting and filing for reimbursement for more services for more kids, our total reimbursement could go down because of the ratios we have to use. And for those states, I just encourage you to look at Michigan and look at Massachusetts. Those are 2 states that have addressed that concern. Their state plan amendments were both approved by CMS, and I expect that more states are going to start taking advantage of that. Okay, so I hope I've adequately explained what free care is. It was a restriction put on the school Medicaid program in '97. That restriction was lifted in 2014, but states actually had to have in their state plan that the ability to take advantage of it, and most of them didn't. So slowly, it's kind of working its way around the country. So let's talk about what free care means to me. And by me, I mean you listening. And hopefully you fall into one of these three buckets: billing company, state agency, state Medicaid agency, or a school district. So let's start talking first about the state agency. Okay? Your state wants to take advantage of free care. And as the state Medicaid agency, it's your job to implement that. What happens before that implementation? What happens before you actually get approved? Well, a couple of things. Your legislature might have to direct your agency to pursue it. I'd like to think, and I think we'd all like to think, that every state Medicaid agency out there is looking at free care and other things that are out there and saying, the minute it hits the street, they say, hey, let's take advantage of that. But they're really super busy. And let's face it, school Medicaid is just a little chunk of what they do. So I know in a couple of examples, California, New Hampshire, for example, the state legislature has actually passed a bill signed by those two governors that says, state Medicaid agency, take advantage of this free care change in guidance. So I don't know if every state requires their state legislature to tell the Medicaid agency to take advantage of this, or if that was just kind of a political thing in those two states to really bump up the priority. And again, I think that free care in school Medicaid is on every state Medicaid agency's radar, but so are lots of other things. And remember, school Medicaid is just a little piece of your state's total Medicaid program. So state agency, you might have to get involved with the legislature, or you might have free care in school Medicaid on your to-do list for 3 years from now, and all of a sudden your legislature could change your priorities. So once you decide to move forward, you actually have to create a state plan amendment. You have to send it to CMS, and CMS has to approve it. First, you have to decide how to word it. Do you want to go really narrow? CMS, we want to change our school Medicaid program in this little way. So, for example, Connecticut only expanded their reimbursement for 504 plans. So if you're a student in Connecticut and you're on either an IEP plan or a 504 plan, your school district can file for reimbursement. But if you're on an IHP, individual health plan, that's not covered in Connecticut. Okay. There are other states that have gone big. California went big. Michigan went big. Not only did they basically remove all limitation that, remember their state plan used to say IEP plan. They all got rid of IEP plan. Now it just says Medicaid eligible kids. And I know in the case of both of those states, they added additional services that were covered. Okay. So, that's it. So post-free care. Free care has been approved in your state, and you're the state Medicaid agency. What changes? Well, a couple things. Your internal processes are going to change, because before you were probably dealing with the special education department at every one of your school districts. Now, these kids under the free care guidance will not necessarily, they won't be receiving special education services. So, your internal processes are going to have to change. Your audit requirements are going to have to change. Today, when Medicaid auditors show up in a school district that doesn't do anything with free care, those auditors ask to see the IEP, they ask to see the evaluation, they ask to see the parental consent, those sort of things. Well, these are kids who are not covered by IDEA, so there will be no IEP. Parental consent is an IDEA requirement, so there will be no parental consent under IDEA. And when your auditors show up at a school district, all of a sudden, your auditors need to understand the difference between the types of plans that those kids are under and those audit requirements. And state agency, you're probably going to have extensive training internally for your auditors, for the people administering your program, and you're going to have some pretty significant training for the LEAs or the school districts that are out there. And I also say in this bullet, you need to train the billing companies in your internal processes or the changes you're making, because so many school districts rely on their billing companies. Okay, so if you're a school district or an LEA, let's talk about how it's going to affect you. I just talked a little bit about from the state agency. Here, it's going to be a little bit different in your school district. Your internal operations have to change. 99% of all the school districts I have ever dealt with do the parental consent stuff in the special education department. They have the IEPs that authorize school Medicaid in the special education department, in the file room. These are kids who are not receiving special education services. So, where are the authorizing documents going to be? You don't have to have parental consent under IDEA, but you still have to meet your FERPA obligations. How are you going to demonstrate that you're meeting your FERPA obligations? Okay. Where is the authorizing document? Again, the authorizing document in most states today is the IEP. These are kids who don't have an IEP. What is the authorizing document, and where are you keeping it? Second one is staff development. You're going to have to discuss with your staff their documentation levels. Okay. There are school districts out there still who want a list of Medicaid eligible kids because those are the only ones they want to document. Now, you could be dealing with your entire student population, not just the special ed kids anymore. Getting a list of Medicaid eligible kids is just not going to be feasible, and giving it out to your staff so they're only documenting on certain kids. And we all know that eligibility changes all the time. So you're going to have this professional development with your staff. And again, with your staff, you don't have to talk about parental consent under IDEA. You do have to talk about parental consent via FERPA. So how are you going to handle that? Okay, when you are notified by your Medicaid agency that you're going to be audited, you have to start putting all your files and your documentation together. Today, most folks go to their special education department. They start pulling records because they're all in the kids' folders there. These are kids who, some of these kids in the audit will be receiving special ed services. Some of them will not. Where are you going to get all that paperwork, and who's responsible for doing that? If you're in a cost reimbursement state, your cost reporting is likely going to get more complex. Maybe not dramatically complex, but it could. Your existing cost report might stay exactly the way it is, and maybe you'll just have to do a second cost report for the services, outside of the special education world. It just depends on how your state has structured their processes. So again, school districts, you hear that free care is coming and there's potential for more reimbursement. Yay, good for you. You immediately need to start looking at your internal processes and your internal programs. Last, billing companies. So many billing companies started out where somebody was the special ed director at a school district and they knew a programmer, or a school business manager understood the school Medicaid program and they started their own little company. But a lot of it was tied to special ed. In fact, so many school districts today work with IEP software companies who also have Medicaid billing divisions or Medicaid billing components within their special ed software. So their online logging is integrated with their IEP system. Well, if free care is coming to your state, you make sure that you do a complete walkthrough of your software systems to make sure you can handle non-special education services for your school districts. Likewise, you need to check your consulting information. Most billing companies know everything there is to know about special education related services and school Medicaid. But what about services that have nothing to do with special ed? So you need to know the rules around the authorizing documentation. Connecticut, you need to know that what goes into the 504 that authorizes reimbursement. But what about a state like California that basically allows billing for all kinds of new services? You need to make sure that you're up on all of those sort of things when you're dealing with your school districts. Okay. Now, several billing companies out there provide cost reporting services where they actually complete the cost report for their customers. So if you're a billing company and you're in a cost reporting state and they expand to cover all these students, what changes are going to impact your cost reporting services? You know, the only way for you to know is to get with your Medicaid agency and get the information. That brings me to my last point. This is not a blanket statement for every state, but billing companies don't always have the greatest relationship with the state Medicaid agencies. In some states they do. And for the billing companies on the call today, I really hope you guys do, but sometimes they don't. You know, to the billing companies out there, you are not the Medicaid agency's customer. Their customers are hospitals, doctors, Medicaid covered individuals, and school districts. So a lot of times the Medicaid agency will be good about answering questions you ask them, but not necessarily proactive in either sending out information or inviting you to meetings with school districts. So if you're a billing company and free care comes to one of your states, my suggestion is to proactively contact the Medicaid agency the minute you hear it's coming and ask them to provide the same kind of resources, documents, trainings, all those kind of things that they provide to their school districts, because you are doing nothing but helping their customers, the school districts, take advantage of these changes in a very compliant way. All right. That's it for today's session. I wanted to share with you not only the basic definition of free care, but also kind of how we got there so you understand what a big deal it is. Then I shared with you my thoughts on how free care might affect the daily lives of people who work in the Medicaid agency, in school districts, and billing companies. I hope it was helpful and it gave you some good information. So, in a few minutes after I shut down the luncheon hour, you guys are all going to get an email, hopefully, that asks you to click on a link and give us feedback on the topic today. It's a 6 or 7 online survey. It's anonymous. I don't know who you are if you don't tell me who you are. So if you wouldn't mind, please click on that and do that. If you don't want to wait for your email to come, in 10 minutes or an hour, whatever it is, you can go out to our website, go to the About menu, click on Workshop Feedback, and it takes you to that same online survey. Here are a couple of other resources you might want to investigate. On Facebook, we have a school Medicaid discussion group. Go out and just look up school Medicaid and look for that little logo or that little image and just ask to join. Post lots of articles. People post questions. It's a really great resource. The other one is NAME, National Alliance for Medicaid and Education. There is their website. NAME is the National School Medicaid Association. They had their annual conference a couple weeks ago. They have lots of really great resources. There are a lot of people at NAME who are watching free care from around the state. There are a lot of NAME members who have gone through free care in their state, in some of the states that I mentioned earlier. So if you have questions, you want to reach out to people, NAME is a really good organization for you to get involved with. So here's my contact information again. Really appreciate everybody who's participating. Hopefully this was good information for you. If you have questions or comments, give me a call afterwards or drop me an email, and hopefully we'll see you on another future luncheon hour. Thanks.